My name is Marta Rodríguez-Carrasco. I am a gastroenterologist and a PhD student in the Portuguese Institute of Oncology of Porto in the north of Portugal. On behalf of all others, I am pleased to introduce our study COVID-19 and endoscopic management of superficial gastrointestinal neoplastic lesions, a multinational cross-sectional survey. Since March 2020, we are facing an exceptional situation over the world with highly restrictive considerations due to the COVID-19 pandemic. Because of the potential risk of transmissions during the endoscopic procedures, ESG recommended to decide to perform or to postpone elective endoscopic procedures according to the morbidity and mortality risk related to COVID-19 and the disease priority. As a result, during the last months, the usual workflow of endoscopy departments changed and the number of postponed procedures increased progressively. Several studies showed the impact of COVID-19 in terms of morbidity and mortality, but less studies analyzed the indirect consequences of the pandemic on the treatment and prognosis of other diseases like neoplastic lesions. The aim of our study was to report the impact of lockdown period on endoscopic treatment and prognosis of superficial gastrointestinal neoplastic lesions in countries with different severity of the pandemic. Since the pandemic is still unpredictable and future waves can happen, it is important to us to know the possible clinical implications of postponements on the treatment of neoplastic lesions. Our study showed that during the early lockdown period, 55% of the procedures were postponed, which was 11 times higher than those during the same period in 2019. Moreover, if we consider the severity of the pandemic, this proportion rose to 76% in countries highly affected by the pandemic and decreased to 26% in those with less impact. The mean plane time to perform the rescales was within the ESG recommendations, and only 3% of the patients were expected to have a negative impact by reallocation and may require an elective surgery instead of an endoscopic treatment. However, at the time of completing this study, some centers were still working under severe restrictions, so the majority of the postponements were still waiting to be performed, and this represents the principal limitation from our study to have a strong conclusion about the real impact on prognosis. So future studies considering histological results after resection could confirm with more precision our results. In conclusion, the current pandemic had a considerable impact on the endoscopic treatment of neoplastic lesions, leading to an important increase in postponements, especially in countries severely affected by the pandemic. Nevertheless, timing for reschedule seems to be optimal, and although the real impact in terms of staging is still unknown, it is estimated to be unaffected. Thank you very much.